Over 60? 5 easy chair exercises for stronger knees. If you are over 60 and your knees feel stiff, weak, painful, or unpredictable, you are not alone. Many people at this stage of life believe knee pain is simply something they must accept. They think it is the price of aging. But that belief is wrong. The truth is, knees do not weaken because of age alone. They weaken because of inactivity, muscle loss, joint stiffness, and fear of movement. And here's the good news. You do not need squats. You do not need lunges. You do not need to get down on the floor. You do not need to push through pain. In fact, some of the most effective knee strengthening exercises can be done while sitting comfortably in a chair. Today, I'm going to show you 5 easy chair exercises that are safe, gentle, and incredibly effective for people over 60. These exercises are designed to strengthen the muscles that protect your knees, improve joint lubrication, and restore confidence in everyday movement. You can do them at home. You can do them in ordinary clothes. And you can stop anytime you need. Before we begin, let me explain something important. Your knee is not a single muscle. It is a joint supported by a team of muscles, the quadriceps in the front, the hamstrings in the back, the calves below, and the hip muscles above. When even one part of that system weakens, your knee absorbs stress it was never meant to handle. That's why pain often appears during simple activities like standing up from a chair, walking downstairs, or getting out of a car. These exercises work with your body, not against it. They wake up sleeping muscles. They increase blood flow. And they help your knees feel more stable and supported. Now let's begin. Sit comfortably in a sturdy chair. Your feet should be flat on the floor. Your back relaxed but upright. There is no rush. Breathe normally. Exercise 1. Seated knee extension. This is one of the most important exercises for knee strength, especially after 60. Right now, most people have weak quadriceps. These are the large muscles at the front of your thighs. They act like shock absorbers for the knee joint. When they weaken, your knee takes the impact instead. This exercise gently reactivates those muscles. Start with both feet flat on the floor. Slowly straighten your right leg until it is comfortably extended in front of you. Do not lock the knee. Just straighten it as far as feels natural. Hold this position for 3 seconds. You may feel the muscle at the front of your thigh working. That's exactly what we want. Then slowly lower your foot back to the floor. That's 1 repetition. Now switch to the left leg. Lift. Hold for 3 seconds. Lower. Move slowly. No jerking. No forcing. If lifting the leg fully is difficult, lift it halfway. That is perfectly fine. Progress comes from consistency, not intensity. Aim for 10 repetitions on each leg. As you do this exercise regularly, something important happens. Your knee begins to feel more stable. Standing up becomes easier. Walking feels less tiring. This single movement teaches your body how to support your knee again. Exercise 2. Seated heel slides. Many people over 60 struggle with knee stiffness more than pain. The joint feels tight. Movement feels restricted. Bending and straightening become uncomfortable. This exercise improves joint mobility and lubrication, which is essential for knee health. Sit comfortably with both feet on the floor. Slowly slide your right heel backward toward the chair, bending your knee as far as comfortable. Do not force the bend. Stop before pain. Hold for a moment. Then slowly slide the heel forward, returning your foot to its starting position. That's 1 repetition. Now switch legs. As you perform this movement, imagine oil being gently spread inside the knee joint. That's exactly what's happening. Motion feeds the joint. Aim for 10 slow repetitions per leg. If your knee feels stiff at first, that's normal. It often loosens up after a few repetitions. This exercise is especially helpful first thing in the morning or after sitting for long periods. Exercise 3. Seated hamstring activation. The muscles at the back of your thighs, the hamstrings, play a huge role in knee stability. Weak hamstrings allow the knee to shift and strain during walking and standing. This exercise strengthens them without stress. Sit with both feet flat on the floor. Dig your heels gently into the ground as if you are trying to pull them backward, but do not actually move them. Hold that gentle tension for 5 seconds. You should feel the muscles at the back of your thighs activate. Then relax. That's 1 repetition. This is an isometric exercise, meaning the muscle works without joint movement. It is extremely joint-friendly and perfect for sensitive knees. Repeat this 10 times. Breathe normally. Keep the effort gentle. Over time, this exercise improves balance and knee control, especially when walking on uneven surfaces. Exercise 4. Seated calf raises. Strong calves protect your knees more than most people realize. They absorb shock and help control movement when you walk, climb stairs, or stand up. Sit with both feet flat on the floor. Slowly lift both heels off the ground while keeping the balls of your feet down. Hold for 2 seconds at the top. Then slowly lower your heels back down. That's 1 repetition. If lifting both heels is difficult, lift 1 heel at a time. Aim for 15 repetitions. This exercise improves circulation, ankle stability, and overall leg strength, all of which reduce knee strain. Exercise 5. Seated marching. This final exercise ties everything together. Sit tall in your chair. Slowly lift your right knee upward as if you are marching. Lift only as high as comfortable. Lower it slowly. Then lift the left knee. Alternate sides. Move slowly and with control. Aim for 20 total lifts, 10 per leg. This movement strengthens the hip flexors and improves coordination. Strong hips reduce pressure on the knees during walking. At this point, you may notice something surprising. Your knees may feel warmer, looser, more awake. That is a good sign. You've just reminded your body how to support your joints again. Now that you know the 5 chair exercises, let's talk about something just as important as the movements themselves. Consistency. Most people over 60 do not fail because the exercises don't work. They fail because they do too much, too fast, or they stop too soon. Your knees respond best to gentle, regular movement, not intensity. So here's how to use these exercises correctly. How often should you do these exercises? If your knees are painful, stiff, or weak, start with 3 days per week. That could be Monday, Wednesday, and Friday, or any 3 non-consecutive days. If your knees feel okay and you're mostly trying to stay strong, you can do them 5 days per week. Each session should take 10 to 15 minutes. That's it. More is not better. Better is better. If you ever feel soreness the next day, that does not mean you did something wrong. Mild muscle soreness is normal. Sharp pain inside the knee joint is not. If you feel joint pain, reduce the repetitions or take a rest day. Your body adapts during recovery. The biggest knee mistakes people over 60 make. Let's clear up a few common mistakes that quietly destroy knee health. Mistake number 1, avoiding movement entirely. Many people stop moving because they are afraid of pain. But stiffness creates more stiffness. Weak muscles make joints less stable. The knee needs movement to stay healthy. Mistake number 2, forcing painful exercises. Pain is not progress. If an exercise hurts your knee, modify it or stop. Chair exercises exist specifically to avoid joint strain. Mistake number 3, focusing only on the knee. The knee does not work alone. Weak hips, thighs, or calves will overload it. That's why these exercises target the entire leg. Mistake number 4, comparing yourself to others. Your knees have their own history. Injuries, surgeries, arthritis, and years of habits all matter. Your job is not to catch up to anyone. Your job is to move better than yesterday. How long until you feel results? This is one of the most common questions. Most people notice less stiffness within 7 to 10 days. Better confidence standing up within 2 to 3 weeks. Improved strength and stability within 4 to 6 weeks. Pain reduction often follows strength, not the other way around. The stronger your muscles become, the less stress your knees feel. How to progress safely. After about 4 weeks, you may feel ready to progress. Progress does not mean adding weight. It does not mean harder exercises. Here are safe ways to progress. Add 2 more repetitions to each exercise. Hold positions 1 second longer. Slow down your movements. Focus more on control and posture. Slower movement equals more muscle activation. If you ever feel unsure, stay at your current level. Staying consistent beats progressing too fast. What about arthritis? If you have knee arthritis, these exercises are especially important. Arthritis does not mean you should stop moving. It means you should move smarter. Motion increases joint lubrication. Strong muscles reduce bone-on-bone pressure. Controlled movement reduces inflammation over time. Always stay within a pain-free range. Mild discomfort is okay. Sharp pain is not. If you've been told you need surgery someday, understand this. Strong muscles can delay or sometimes prevent that outcome entirely. A simple daily knee routine. Here's how a full session might look. Seated knee extensions, 10 per leg. Heel slides, 10 per leg. Hamstring activation, 10 holds. Calf raises, 15 repetitions. Seated marching, 20 total lifts. Rest as needed. Breathe normally. Sit tall. That's your routine. No gym. No equipment. No floor work. When to stop and get help. If you experience sudden swelling, locking or catching, sharp stabbing pain, pain that worsens over weeks, pause the exercises and consult a medical professional. These exercises are safe for most people, but your body always has the final say. The mental side of knee health. This part matters more than most people realize. Fear changes how you move. Fear causes stiffness. Fear causes hesitation. Confidence restores natural movement. Every time you complete these exercises, you're not just strengthening muscles, you're teaching your brain that movement is safe again. That confidence carries into walking, standing, and daily life. Before we finish, there are a few very important things you need to understand about knee health after 60. These are the things no one usually tells you, but they make the difference between temporary relief and long-term strength. Let's talk about why these exercises work, even though they look simple. Your body responds to signals, not effort. When you sit and gently move your legs, you are sending a message to your nervous system that the knee joint is safe. Once the brain feels safe, muscles activate more fully, coordination improves, and stiffness begins to fade. That's why aggressive exercises often fail older adults. They trigger protection. Protection leads to tension. Tension leads to pain. These chair exercises do the opposite. They create trust between your brain, muscles, and joints. Why sitting is not a weak option. Some people feel embarrassed doing chair exercises. They think standing exercises are more real. That belief is wrong. Sitting removes unnecessary stress so your muscles can work correctly. When the muscles are strong enough, standing becomes easier naturally. Think of the chair as training wheels, not a limitation. Many physical therapists start knee rehabilitation in a seated position, even for athletes. The hidden role of breathing. Here's something subtle but powerful. If you hold your breath while exercising, your body tightens. Tightness increases joint pressure. So during every exercise, Inhale through your nose. Exhale slowly through your mouth. If an exercise feels difficult, slow your breathing before slowing your movement. Breath tells your body it's safe. A gentle bonus chair routine optional. If your knees are feeling better and you want a little extra support, here is a bonus seated routine you can add once or twice per week. These are not required. They are optional. Bonus exercise 1. Seated leg press, no equipment. Sit tall in your chair. Place both feet flat on the floor. Press your feet down into the ground as if you're trying to stand, but don't actually stand. Hold that pressure for 5 seconds. Relax. This strengthens the muscles used for standing up without stressing the knees. Repeat 8 to 10 times. Bonus exercise 2. Seated inner thigh activation. Place a small pillow, rolled towel, or even your hands between your knees. Gently squeeze your knees inward. Hold for 5 seconds. Relax. Strong inner thighs help keep the knee aligned and reduce strain. Repeat 10 times. Bonus exercise 3. Ankle circles. Lift one foot slightly off the ground. Slowly rotate your ankle in a circle. 5 circles in one direction. 5 in the other. Switch feet. Healthy ankles reduce stress traveling up to the knees. What to do on bad knee days? Some days, your knees will feel worse for no obvious reason. Weather changes. Poor sleep. Stress. Dehydration. On those days, reduce repetitions. Move slower. Focus on heel slides and breathing. Do not quit completely. Gentle motion often improves pain faster than rest alone. What to do on good knee days? On good days, resist the urge to overdo it. This is where many people accidentally flare their pain. Good days are for maintaining, not testing limits. Consistency beats enthusiasm. Standing up and sitting down safely. Here's a practical tip that protects your knees every day. When standing up, scoot to the edge of the chair. Place feet slightly back. Lean forward slightly. Push through your heels. When sitting down, reach for the chair. Control the descent. Don't drop suddenly. These small habits reduce knee strain dramatically. The long-term truth about knee strength. Strong knees are not built in weeks. They are built in habits. 5 minutes today is better than 30 minutes once a month. If you stay consistent, your knees feel more predictable. Balance improves. Walking becomes easier. Fear decreases. That's real progress. You are not fragile. You are adaptable. Your knees are capable of improving at any age. You don't need extreme workouts. You don't need pain. You don't need expensive equipment. You need gentle movement, patience, consistency, self-respect. Sit down. Move with intention. Breathe. Repeat. That is how strong knees are built, even after 60.